Panic tuloy ako. Hello, welcome back to Iking Live. I'm your host, Iking from European Business. We go to the World Cancer Celebration, and for that we have Dr. Mary Ann Reyna. I can't put in all of her titles because I ran out of space. The only thing I recognize here is MD. What
Yes.
are the other three, Doctora?
The fellow in College of Radiology,
All
the
right.
fellow in Philippine Society of Medical Oncology, and of course my specialty, fellow of the Philippine Radiation Oncology
Oh,
Society.
I'm your fellow Filipino.
Yes, sir.
Okay.
Nice to meet you, sir.
Oncology is about cancer treatment.
Yes, sir.
Okay, first tell us what it is all about, and then tell us why are you celebrating it, and what is your program in relation to the rest of the world.
Okay. Oncology is actually a branch of medicine that deals with cancer treatment. Um, in general.
Mm-hmm.
So under oncology, you have the different subspecialties, but mostly the two major group under oncology would be the medical oncology, those doctors who handle the chemotherapy, which
Mm-hmm.
everybody knows about, and the kind of new uh, kind of mode of treatment here in the Philippines, which is radiation oncology, and that is what I do. Under that, we have the surgeons specializing in cancer treatment. We call them surgical oncologists. We have the ENT oncologists, the gyne oncologists, and so on and so forth. So in general, cancer can be treated multidisciplinarily. So it doesn't have to be like in the past that you do surgery and then you send for chemo. Now we sit down together as a group and then we think which is the best way to manage this particular
Can it
patient.
include food?
Yes, sir. It includes food.
Okay. Um, let's try to bring down the discussion. I will ask you maybe a more simple question. Yung, yung may cancer, may pag-asa pa.
Okay. So, if may cancer po, depende yan kung anong stage nakuha. So, normally we have 4 stages, no? As you go one step up on
Pag
the
4 na,
number,
wala na.
that's the late stage, sir.
Pero pwede pa. Can
We
you still
do
try?
palliative. We just improve the quality of life of the patient.
Mm-hmm.
But we're not really after
Prolonging
for
or improving?
both, sir. By improving the quality of life of the patient, the life would go longer.
What if stage 1?
Oh, stage 1, that is curable, sir.
Really?
Yes.
Up to what stage?
It depends. Up to stage 3, we can do full
Really?
treatment with 5-year survival, 10-year
Oh, really?
survival. Yes, sir.
Let's say stage 2. And what is your success rate?
Oh, for stage 2, it depends on the type of cancer. There are aggressive
Okay.
type of cancer. There are slow-growing cancer, which is not really that aggressive. So, maaga mo siyang makukuha.
Mm-hmm,
No?
mm-hmm. So, the key is early detection.
Of course, sir. Yes.
How do you do that?
Well, every year, you're supposed to have your annual checkup, right? And for here in the Philippines, our most common cases would be the breast for the females and the gynecologic, the lung and the prostate for the males. And all these things, it can be detected, screened by
Yung
annual
sa
PE.
female, is that just one test or 3 separate tests?
For the female, sir, it's just for the breast, it's just self-breast examination.
Mm-hmm.
For the gynecologic cases, then you can do pap smear. So that should be yearly done.
Mm-hmm.
For the males naman, if you are over 40, then rectal examination of the prostate. For the lung, it's just a common X-ray.
Are those affordable tests?
Yes, sir, it is. It is very...
Can you get that from a public health facility?
Yes, sir. Probably except for the X-ray, it has to be done outside because it needs
Mm-hmm.
a machine. But the pap smear, the self-breast examination, The self breast examination you can do while you're taking a bath. It's just an
I
instruction
can't do
given.
that,
Oh, of course.
of course.
Of course.
What about pap smear? How much does it cost?
About 70 pesos to 150
Oh,
pesos.
that's
Rural health.
affordable.
Yes, sir.
So, what's the behavior? People are not doing it?
Oh, I don't know. Maybe our natural Filipino culture. Um, and,
Mm-hmm.
bukas na yan, mamaya na. No, but I think in fairness to the government, to the Department of Health, they're really doing their job in promoting cancer awareness, even in the provinces. But there are some people who does not understand. Probably, I think they should improve on the way they promote cancer awareness. Kumisan kasi poster-poster, turo-turo, ganyan, which is not enough because these people does not understand English or cannot comprehend yung science kasi hindi sila nakaaral. So, probably it can be done in a very layman way of things you can play, you can teach with the children. The newer types of process of educating people.
Maybe it's a function of money. It's 200 pesos. It's affordable to us. But
It's affordable.
to them, it's already what? 4 kilong bigas.
Yes, yes.
Could that be a factor?
Yeah, it could be a factor, especially po sa mga probinsya, no? Way up. I served Baguio General Hospital for like 5 years, so I get mga indigenous people who are my patients, and they give me gulay, bulaklak, halaman, iklog, and
You're the
but
kind, huh?
yeah, but it's okay, it's okay.
It's good for your soul.
Yes, it is, sir. It is, it is.
Well, how about the cost of treatment?
Oh, the cost of treatment for chemotherapy that's
Mm-hmm.
covered for both radiation and chemotherapy that's covered by PhilHealth now.
Already? All of
Yes.
it?
Not all of it, but it's the bulk of the cost that is covered by PhilHealth. Especially for us, all our modalities, from the very basic, the conventional treatment, the 3D conformal, the IMRT, the highest form that we can do for difficult cases, is fully covered by PhilHealth, including the plans po. And also the part 2, which is the direct radiation treatment we call brachytherapy, it's also covered by
But you know,
PhilHealth.
most people don't even know that.
Yeah. It has been approved, sir, just last year. And for
Oh, but
IMRT, it's November.
maybe they haven't communicated that.
They published it,
I
sir.
think you know that the general perception now is number one, cancer is hard to cure or incurable. Number two, it's expensive. Number three, you have to spend your own money, right? But now you're telling me it's curable and PhilHealth covers it. That's fantastic news.
Yes. Really, sir. We
Mm-hmm.
were so happy that PhilHealth finally decided to cover
Mm-hmm.
cancer treatment as of November of last year.
Mm-hmm. Curable. So, do you have statistics? How many are, what do you call it? Affected, infected? What's the term that you use?
Afflicted, sir.
Afflicted.
Yes.
Okay.
Okay. Here in the Philippines, it would depend on the type of cancer, again,
Mm-hmm,
by
mm-hmm.
system. But because breast cancer and cervical cancer, the lung and the prostate, these are extensively studied, we have higher success rates provided that it is diagnosed early.
Mm-hmm.
No, and this is actually part of what PhilHealth called the level of care. So it's included. The diagnostics is included in the PhilHealth coverage if you
Mm-hmm.
go for an annual P. Yeah, and the treatment we have to apply at our center. We hire dedicated people just to do the PhilHealth so that our patients would not pay
Okay.
anything.
Do you have some numbers? How many Filipinos are afflicted?
Oh, afflicted. So we are a 80 million, 80, 100 million,
100 already.
100 million. Uh, that would be about 40% right now, because It has,
40% are potentially afflicted
yes, sir.
with some form of cancer or another.
Yes, sir. Because
That's a lot. That's about half the population.
we are getting a lot right now, undiagnosed, diagnosed, late stage, early stage, and even children. Cancer cases are getting younger and younger every year. I have 6-year-old patients who in the book says it does not exist for the since 1965, but then we have 6 years old cases of nasopharyngeal tumors. These are tumors behind the ear, and I found those kids up way up in the north, in the mountain regions.
And what is the cause?
Probably the spraying of the insecticides, nutritional status is
Residues from
poor.
mining
Yes,
could be.
could be, yes, sir. And of course, the quality of life that they live, no, they are minors early on in life.
What about air pollution?
Oh, air pollution. Well, in our used to be cold areas, so they are. I'm sorry, it's kind of political, but because of the destruction of this forest and these trees, then pollution even in Baguio City is very poor. It's very high.
No, because you said the more and more people are getting afflicted
Yes.
and they're getting younger and younger. So there must be what a factor that's causing it. Could it be genetically modified organisms? Could it be mercury in the water?
So it is cancer genesis is actually multifactorial. It means that it's a lot. There are a lot of factors contributing to one disease. Like, but mostly it's genetic. It is genetically determined. So if you have a family who member who have a cancer, or in the line there are relatives who have cancer, there is this high risk of probability that you or one of your siblings or your the next generation would get cancer. So
Because you are vulnerable.
vulnerability is
But
to
it's not hereditary.
it's genetic, sir. So it's down in the line. So it can be the vulnerability is hereditary.
It's
Yes,
only the vulnerability
yes,
that is
that's
hereditary,
hereditary.
not the genes.
Yes, not the gene.
Okay, okay. Well, let's say 40 million have one form of cancer or another. Most of those would be curable.
Unfortunately, in our local setup, it is not, sir. We get, like, if we have almost 50% of these cases that we see in our centers are palliative. These are non-curable forms of cancer. We're just alleviating the pains that they feel.
But that's too many. 40 million, not non-curable? That's already what? An epidemic.
Oh, no, sir. It's just half. 50% of the total cases of cancer are curable, and the other 50% that we get here are not curable in the stage 4.
But you're saying that about half the population are vulnerable.
Yes, sir.
That's alarming.
Yes, it is, sir. Yes,
Is
it is.
that secondhand smoke or air
Uh,
pollution again?
Air pollution, secondhand smoke, alcohol intake, mutagenic materials, genetically modified food, sir, that we get.
GMO.
Yes. So
Have
it
you pinned it down to GMO?
um
The GMO is. Hmm?
the gastrointestinal cases are usually associated with genetically modified. That's according to the different texts that is published not here but
Mhm.
abroad.
Well, you're familiar with methane, the methane gas that escapes from a landfill and travels to Metro Manila. Do you think that could be a factor, or carbon monoxide from the vehicles?
Yes, sir. It could also contribute to that because it's all in the air, and basically we thrive on oxygen. So anything that is not helpful. Like this methane is toxic to us, then probably the body would try to correct it or assimilate it and then try to control it. But then in the process, there is mutation that would happen, and that would eventually lead to cancer.
Maybe you could find some historical data that during the time when air pollution is still not bad, incidence is low. Is there data like that?
No, sir. There is no.
But you think
Uh,
there is a correlation?
yes, of course, sir. Even the incidences of cases that we get a lot of lung, nasopharyngeal tumors coming from the north. These are the farming regions. We get a different statistics coming from the southern part. It's different here in the Philippines. It's different in the UK. It's different in the US. So it's what it depends on the trade that they are doing in some particular area. I believe that is so. That is so.
Well, chemical fertilizers could be a culprit.
Yes.
Chemical spraying could be another. But what's happening? I mean, you think this is normal now? This is something that we have to live with?
No, if you can, if we can reverse that, that would be good. But even in worldwide, in the U.S., it's second leading cause of death. Here in the Philippines, it is third, and globally, they are trending like in 2020, it would be number one cause of death in the world.
You know, you might still remember, maybe 20 years ago, used to have this air pollution index
Yes, sir.
in the highways. They've all disappeared. So now there's no way for anyone to know what the air quality is. I've always suspected that that might be a cause of illness, but now you're telling me it's the cause.
Yes, especially for the lung tumors, it's highly associated with smoking, air pollution, and secondary uh, smoke.
Do you have you come across some reason to believe that the poor people could be victimized more than the rich people? Because the rich people ride in air-conditioned cars.
Oh, definitely, sir. Not just with the exposure to this carcinogenics, no. The poor people are more exposed to this carcinogenic because of the way of life that they do as compared to the rich people. Likewise, the rich people have this healthy lifestyle, regular checkup, etc. So then, if you have a very small mole that looks different,
It's
they can have
detected
it,
right away.
yes, removed. But for the patients that we get like atosarias, we get big nodules
Already,
as big as the head, no, but
because
still no treatment.
they did not bother to
Yes, because they
check on
don't
it.
have the resources to go to the hospital.
That's really disturbing.
Yes, sir, it is disturbing.
What about Gacera?
Gacera,
Could it be a cause?
Gacera, I is it still being used? I don't know, sir.
Everywhere, even in Metro Manila.
Okay, so Gacera is using the gas
Kerosene.
kerosene. Yes,
Yes.
so yeah, yes, because kerosene produces fumes, no?
Yes.
Yes, and if you probably daily would have you inhale it, especially for kids, children below 2 years old, the body is still developing, so that would not work well in the long run.
Well, you know, doctor, I was depressed by what you said.
Oh, I'm sorry.
Discouraged. But, well, I'm looking at something here that came from you also.
Mm-hmm.
It's hopeful, huh? Healthy life choices is not beyond us.
Yes.
Okay? Early detection is not beyond us. Treatment for all, wow, is not beyond us. quality of life is not beyond us. Very promising, huh?
Yes,
That's your
sir.
message for tonight. It's right there.
Yes.
Treatment for all is not beyond us. Is that because of technology in general, or is that because of PhilHealth coverage?
Both, sir. Few
Mm-hmm.
years back, we don't have this what we use. Like for example, in my field, we use high-tech machines. Before, if you wanted to linear treatment, you have to go abroad. But now we have
Ah,
a lot of
okay,
centers doing that here, and
okay.
likewise the expertise. We have the experts here now.
Mm-hmm. Well, we're interviewing Dr. Mary Ann Reyna. Medyo may kaunti siyang bad news. Pero nabawi naman pala. Nabawi niya naman pala. Pwede naman pala. A lot of people are vulnerable. A lot of people are afflicted, but treatment for all is not beyond us.
Yes, sir.
No? Fantastic. And you flash a name of a clinic. Clinic po ba yan?
Uh,
That you showed? Or is that an organization? Philippine Oncology
yes.
Center.
That is our center, sir.
Uh-huh, uh-huh. And how many patients are you getting there already?
This is a 6-year-old center
Mm-mm.
in Fairview, beside FEU Hospital, and we're doing a high-end treatment, radiation treatment there. Uh, on a daily basis, we treat almost 50 cases of special. These are special
Okay, so when you
cases.
say it's covered, wala na silang gagastusin on their own, from their own pocket?
Konting-konti po. These are
Hmm.
additional, like for the mask, the additional mask, because that is not covered. The immobilization things
Okay.
that we use,
I'm
yes.
happy to meet you. I might be referring to you some patients.
Thank you, sir.
All right, good night, and thank you for coming,
Thank
Doctora.
you, sir.
Take it away, baby.